So you guys have seen in the press release, of course, Paula, you guys helped write that. But bottom line, we got a problem. We do not have enough skilled care beds. And just to be kind of clear about what those are, in a nursing home, there are typically two kinds of beds. There are residential beds, and then there are skilled care beds. And often those skilled care beds are beds that are utilized after a hospital stay. So a patient who's in the hospital who can't quite make it home yet, but needs some rehab, but maybe isn't rigorous enough to stay in an actual rehabilitation unit within a hospital, is ideal for skilled care. And we've got a dearth of both skilled care beds and nursing home beds in our community. And our group is made up, frankly, of a bunch of people who have experienced the issue. And you'll see a few very familiar faces in here. Our committee leader is Kathy Emanuel. She's out over here on the left-hand side of the screen in the teal blouse there. And Kathy was the vice president of marketing strategic planning at Carle. She left Carle after many, many years. I think she was at Carle for 30 years. I worked with her closely there. And then she went to OSF and did a very similar role at OSF. And so Kathy and I have known each other for a long time. And she's an ideal person to lead our group because she has tons of skills in business planning, developing business plans, marketing plans. And so we've lucked out here and got somebody who's very passionate about it, helping to lead our core group of individuals. I want to just show you who is on the committee. And we serve as a steering committee. It's not anything fancy. You know what I mean? It's just a bunch of us who live in the community, care about the community, and as I mentioned, have had our own issues with trying to find appropriate beds for loved ones that were near our homes so that we could visit them. It's not that easy when maybe somebody is a half hour away or an hour away to get there on a daily basis, which is what people like to do. When you've got a loved one there, you want to visit them as much as you can. And obviously that loved one wants to be visited. And so we've got an issue, and our mission is really to make Champaign County a high quality, safe, and innovative place for aging residents. And I want to tell you, we got so many things that are already pointed in that direction. You know what I mean? We're a great community. In fact, people love to retire here. I mean, Dick and I just had some friends who were gone for 40 years. He was a traveling CEO for Y. So, he had jobs all over the country as a CEO for Y. And guess what? When he retired, they moved to Urbana. I mean, how great is that? So you guys, it's happening because we're a university town. And the university town has also afforded us a lot of positives with regard to aging care. So, we have a lot going for us. But one thing that we don't have going for us is a problem with our nursing home beds. And again, we are short by well over 300 beds. And that is a big deal. We're the only county in Illinois that has that shortage. Now, we knew from the get-go that we could not do this on our own. We're just a bunch of people, community people. It's not like we have a lot of power and authority. But you know what? When energetic people who have a mission get together, by golly, something's going to happen. And fortunately, we've been able to pull together, as you can look carefully at these graphic elements, and you can see all of the businesses, the government functions, other entities, other not-for-profits that are supportive of this effort and will play some sort of role in it or have already. Now, it's obvious here that we have OSF and Carle. And the reason that they are very interested in this, now I will tell you, neither one of them want to own a nursing home. Neither one of them, okay? So they're not signing up to be an owner. No, and I get it. You know what I mean? Been there, done that. Carle used to own Carle Arbors. And that, frankly, is probably now 25, maybe 30 years ago. And they sold it. And running a nursing home is not for the faint of heart. And we know that. It not only is it a challenge from a staffing perspective, but it's also a challenge just from a financial perspective. So what our desire is to work as a cooperative here with this group of community entities and make something happen here that is unique, that is special, and that frankly, people want to come from all over to say, what is happening in Champaign-Urbana? Our desire is that we have a not-for-profit owner, because a not-for-profit owner is an owner that can be supported by these entities. You know, OSF and Carl have numbers and numbers of patients that they cannot get out of the hospital in a timely way because there's no bed for them to go to. And of course, neither hospital is going to kick anybody out. You know, that's not how it works. No way. The hospital keeps people until they have a safe, good place to go. But it takes sometimes days. I mean, everyone on our committee has their own story about their loved one, maybe a mother, a father, a father-in-law, where they have tried to get their loved one in a skilled care bed in our community, but haven't been able to do so, or it's taken them a very long time. And I know in the experience that I had, we had on 2 occasions, it's an older couple that my family and I helped take care of because their children live in California. And we tried to get them, they both were in the hospital. You know how this happens. They were in their 90s. They're both in the hospital. And by golly, one of them was in 8 days longer at Carl than they needed to be, and the other was in 10 days longer. Now, we were lucky, and of course, Carl didn't kick us out, kick them out. That, of course they didn't, but it took us that long to find a place. And finally, a bed opened at Clark Lindsay, which we were lucky, and whew, I just went like that. And then the other situation ended up being in Gifford at Country Health. So these entities care about this problem. United Way is supportive and can play a role in this. The Community Foundation, you'll see them listed here. They are actually helped us with our 501c3. Yay, we didn't have to create one. You know, we used our resources. And so this has been terrific. And they're actually holding any donations that we get. And you're going to ask me later about why we need donations, and I will tell you, okay, about why that's the case. And then, of course, you'll notice Champaign-Urbana Public Health. We've got the Champaign County Healthcare Consumers. We've got our county board. And I will say our county board and public health departments have been terrific. You know, the county board cares about this. They do. It's a bummer. You know, we lost our nursing home. You know, we lost it, and it was big. You guys, that was a huge facility. It had over 200 beds. So, wow, when that closed, you can hear just a big sucking sound of the number of beds that are available, right? I mean, there you go. Boom. There's 200 of the 300. And then, you guys, there have also been other nursing homes that closed. And I have a listing of those in a little bit. But we've got Parkland involved because Parkland does a lot of training for healthcare techs. We got the University of Illinois involved, the College of Applied Health Sciences. They have tons of researchers in health tech because our goal is to bring health tech to this facility so that we're doing things uniquely and not the same old way. Because you guys know, you've been in nursing homes. Can't you yourself envision a better situation? You know, can't you? Think about it. Just put a picture in your mind of the homes that you've been in and think, you know what, we can do this better. And I think that every time I'm in one, and you know what, hey, people are trying. You know, there's nobody really to blame here. That's not the issue. But we know that we can collaborate with our community to do more and to do better. So what have we done so far? So we've been together since last May. We've conducted some surveys. You know, it was our big idea thinking, okay, this is a problem. But you know what? You can't go and try to sell an idea just on anecdotes, right? You got to have the data. And so we asked public health and we asked the county board if they would help to fund and support a survey. And by golly, we got a great reaction. The Champaign County Board helped pay for it. Public Health Board also helped pay for it. And actually Champaign Public Health did the survey because they have a lot of researchers there. People are very qualified to do this type of thing. And this is interesting. We were hoping we'd get 500 people to respond. And look at that. We had over 900 people answer our survey. And that was great. We felt great about that. So clearly, we were told that that is a good statistically significant sampling to verify the same problems that we felt we had. And so I think you guys saw this in the press release, but what's interesting is the state of Illinois is growing in population a little bit, 3%, but guess what? Champaign County is growing by almost 15%. So that's good news for us. You know what I mean? A growing community is a good community to live in. And then our median age is up, and I can't quite see that number. Oh, sorry, you guys. I got to move my little pictures of you guys. Oh, yeah. And the number of people over 60 increased by 67%. Isn't that remarkable? Yeah. So you know what? I'm one of those. Yeah. So we're hanging around. Good old baby boomers. You got to love them. You know what I mean? But we are definitely getting older, and we will be the group that will be needing potentially this care, you know, down the road. But you can see here the problem. I think this is pretty easy to look at. So we're home to a lot of assisted living. I think all of you know that. You drive by them, right? That's something that people know. And we are only home to 4 skilled nursing facilities. So Accolade is in Savoy. That's the old Carl Arbors from way back, if you remember that. And then Clark Lindsay. Clark Lindsay, I think, used to have, 100 beds or maybe 101 or 2. And they eliminated about 50 beds. And you say, well, why did Clark Lindsay do that? Well, here's the deal. The nursing home business is hard to run. And so they're focusing on the people who have signed up for their total care. So you totally get, you know what I mean? And so they're building other types of living situations. I can't remember the name of it, but the greenhouse model, you know, where there's like small group homes, which are looking a little more like people who might have been a resident in a nursing home, but they have more care. You know what I mean? It's a smaller group, smaller cohort with more care. So Clark Lindsay's just, it's editing its model. And I get it. You know what I mean? It's editing its model. So through that, they lowered their beds by 50. And then we have the one in Gifford. You guys, that's 30 minutes away. I mean, that's not like ages away, but it's still 30 minutes away. And if you've got somebody who maybe their wife is 90 and they're in the nursing home, and then the husband is 85 or 92, he's still driving. But really, do you want him on the road that far? I don't know. You know what I mean? Maybe it's totally fine. But you've got to admit that is a risk the farther away that somebody, is from their loved one and their families. So the survey did verify what we knew anecdotally. And of all the people that answered the survey, 70% in saying that they needed long-term care or a loved one needed long-term care, 70% said that they had trouble with securing a place. Limited services, difficulty with finding facilities. So we were able to verify what we believed anecdotally. And currently, what the consumer said, affordability, staffing shortages, which we're aware of, limited services. So some nursing homes can't take all types of patients. That's an issue. And Carl and OSF care about that, because sometimes a nursing home might have a bed, but that bed won't accommodate the issues that the patient has. For example, maybe they need dialysis and the nursing home can't figure that out. Maybe they need an expensive medication and the nursing home can't afford that. Or maybe they need a special type of bed, and the nurse, from a mechanical perspective, and the nursing home doesn't have that. So honestly, OSF and Carl want us, if we're able to pull this off, to make sure that we are offering an array of types of services so that the facility that we create and build can not just meet certain patients' needs, but frankly, a lot of people's needs, and more than what the current homes are able to. So we've got a shortage. That's the problem. And we also did another market study. So we brought in a consultant by the name of Greystone, and Kathy and Anne, who's on this call, as well as a couple others, were very involved in vetting an appropriate marketing company, a consulting company, to come in and check out our market, because we needed something official, to be able to show a potential owner. Because you guys, our group doesn't want to own the nursing home. That's not our deal. We're trying to be the fishing lure to catch the right not-for-profit owner. So that's how I would describe us. We're like, we're tossing out our line and we want to reel somebody in that's really juicy, somebody that's great. And here, we need not-for-profit because we want this to be a community asset. And as you guys know, a not-for-profit, in my mind, how I look at it, is kind of owned by the community. They have a local board, they have local oversight, and that's what we're going for. A place where, frankly, we have a big auxiliary. I'm not wearing a pink coat, but, I'm not wearing one of those jackets, but hey, I would definitely be on the auxiliary. You know what I mean? A supported facility where people are loved on daily. That's what I envision. I mean, I know that's what so many people in our group, envision. So the company came in and they checked out our territory, our area. And of course, they confirmed that, yes, we have a nursing bed shortage, nursing home bed. And they also reminded us that, isn't this interesting? Champaign County is currently one of 2 counties in the state with bed shortage greater than 10. So in other words, the other one doesn't have much of a shortage. We have a huge shortage, but there's only 2 counties. Now, if we do this, we'll have to have a certificate of need in order to build a nursing home, a skilled care. And that's not always an easy road, but we believe we have a very good story because our own Illinois Department of Public Health is telling us that we have a shortage. So, and that's the same business or entity that would authorize us and give us approval through a certificate of need. So they obviously pointed that out to us. And everything, Illinois is overbedded. So there's too many nursing home beds in Illinois, but not in Champaign County. So bottom line, we have got to have a collaboration to be able to enhance and provide the services that our community needs to make this a great place to age. And we believe that we can make a difference by setting the table for a new owner to come in and possibly build a skilled care facility, frankly, with the community support. Because you know what? Nobody's going to come without community support. And the other thing that we learned from Greystone, and I think, is that the best way to do this is in the context of all the services. You can't these days, I mean, you could, but it'd be tough just to build a new nursing home. And that's all you have. You have to do it in the context of independent living and assisted living. And our community has quite a bit of assisted living, honestly. Greystone told us that there's a little room for more assisted living, not much. And there's quite a bit of room for some more independent living. But the independent living and the assisted living in a model of care helps to support the skilled care and the residential nursing home care. That's the deal. And so ideally, we interest someone or an owner who does all of it. You know what I mean? Who doesn't just build a nursing home, but who also would come in and either buy or own or build a whole center. And you say, well, wait a minute, we already have one. We have Clark Lindsay. And you know what? We do. And Clark Lindsay is great. It's terrific. It's run incredibly well. And Deb Reardon is the CEO there, and we engage her in our every step. So she's involved in what we're doing. I mean, she knows what we're doing. And we would love it if they do it and expand it. They're not in a position to do that right now. I mean, I don't want to speak for her, but they got a lot of things cooking right now. They got a lot of things going. So I think that that we're going to have to find another opportunity. And have we secured it? No, but we have some ideas. But bottom line, we really thank our community so far. Everyone has been extremely supportive, and that gives us a lot of encouragement. You know what I mean? That gives us a lot of, we feel like we can make something happen because of the interest, and particularly the county board. And I think that I hope that there's even more support that we can gain from the county board. And Champaign Public Health, I think, they'll continue to play a role in helping us hopefully make this happening. And before I get to really, how can you help? I want to mention, and you guys know this because this is in the news, so I'm not telling you anything that you don't know. But Carl is selling Windsor of Savoy. And so the Windsor of Savoy, guess what? It's a independent living and it's assisted living. It does not have a skilled care facility. In my opinion, it's my humble opinion, they need one. And so wouldn't that be fun if the new owner is called Greencroft, and they're out of Goshen, Indiana. And Kathy and I think a couple others really dug into them because Cassie's got some relatives live in Goshen, and they are not for profit. They're Mennonite based, but of course for everyone. And they do public aid and Medicaid, and of course private pay. And that's important to our group. Our group wants this to be a place for everyone, not just people who can pay. We need a great place for people who can pay, but we also need a great place for people who can't pay, through public aid, who get their payments through public aid. And that's the hard part, you guys, is to make this work, make the model work, because in Illinois, sadly, the public aid rates are very low. And so it's very challenging for a nursing home, either for profit or not for profit, to be able to make money in that situation. But we have an opportunity. Hey, no guarantee. And here, I want to tell you this. If it doesn't work out with Greencroft, Kathy has already met with them. She's talked with Greencroft. So we have their ear, their ear is perked up, but that's all, because the sale is not completely finalized, and it probably won't be till the end of the year. But we hope after the first of the year, we'll have an opportunity to speak with them about the possibilities and all that we think that our community can bring to the table for them. Because you guys, that's got to be the story to get anybody to come. It's just that rough. It's that hard, to do skilled care. So how can you help us? Well, first of all, I'd love it if, and I don't know, Paula, how best to do this, but if those of you who are interested in being on our advocate list, hey, it does not mean any work at this point. No work, no money. All it means is that you are supportive of our effort. That's all it means. Right now, we have over 300 people. Sorry. We have 300 people. I'm going to stop sharing on our, good, now I can see more of you. We have 300 people on our list, and it's growing. And that's encouraging to us. And so and again, Paula, you can maybe advise me the best way to do this, but obviously, if any of you want to be on it, you can email me and I will forward it to Susan Schnur, who keeps track of our list and handles our website, because we do have a website. Some of you may have looked at it, but it's advocatesforagingcare.org. Yeah, I think so. Yeah, that's it. And so you can email me and I'll send it to Susan, and then you'll be on our list. And what that means is periodically you will get email updates from us. That's all. And so it's not even that often, like maybe once every 6 weeks, because it's not like things happen this quickly. This is going to be a bit of a long haul, but we are not going to let a no from Greencroft, if that happens. I hope it doesn't. I'm keeping my fingers and my toes crossed. But if it happens, we're not going to let that stop us. We're going to come up with something, because we've got to, this is important, and it's important that we continue to pursue it. So your names will be considered as supportees. And so if you're willing to do that, I don't know, Paula, if you think it's just easy for them to email me if you're interested, and I'll just get a bunch of emails and I'll forward them to Susan.
That would be great. Lynn, would you share your email address?
I will. Yeah, it's lcbarnes@illinois.edu. lcbarnes, BARNES, @illinois.edu. And so if you're interested, it'll be easy for me. Just shoot me an email. I'll forward it to Susan. And Susan will go, what are these emails? But she'll be excited to add you to our list. Now, so hey, I'd love to talk with you and answer any of your questions that I can answer.
Okay, so let me invite people to continue to put questions in the chat. We've had a couple so far. Let me start with one, which is, how many not-for-profit entities are there in the US? So if Greencroft doesn't work out, or if there's an opportunity for another not-for-profit to come in, how do you go about, letting them know that we have a need and this might be a good place for them?
Love it. That is a great question. And you know what? We are networkers. And in fact, Kathy and I went to a conference. Oh, I can't remember the name of it now. Aging 2.0. And it was fun. And Kathy and I were probably two of the oldest people there. but it was all about tech and aging. And it was really interesting. But there were people there who own nursing home businesses and many not-for-profit. And in fact, Dr. Wendy Rogers, who is a researcher at the University of Illinois, and she's down the hall from my office in the College of Applied Health Sciences, she's the one that invited us to go. And she hooked us up for lunch with a woman who runs not-for-profits in Kentucky. You know what I mean? And they have a bunch of them. And then then Kathy and I went to speak to, I can't remember the club, Social Sciences Club. I think that was it. And at that club, we met someone who works with, it was somebody at Cunningham Children's Home. And they have an arm of their business that is all about not-for-profit nursing homes. So, you know what I mean? It's networking. It's getting our names out there in terms of, hey, Champaign-Urbana is interested. We've got this group of individuals who are, supportive. You know what I mean? It's making calls. I mean, I know, many of our committee members have been involved in connecting with others. So if Greencroft doesn't pan out, we've got some other leads. It'll take us a while, but we've got some more leads.
Could you explain the financial model of a nursing home? I mean, how are they sustained? And maybe you could also explain the difference between a for-profit model and a not-for-profit model.
Yeah, let me tackle the last question first, because it's the easiest. Okay. All right. So obviously a not-for-profit doesn't mean you don't make a profit, but it means that the profits that you make go back into the business. So, I mean, let's take Carl, for example. I mean, Carl's a not-for-profit. Do they make money? Usually, yes. Not every year, but usually. And that money goes into paying higher salaries for nurses. Man, that's been a need, to buying equipment, to building more beds if needed. So OSF and Carl are both not-for-profit healthcare systems. And for that not-for-profit status, their responsibility is to give back in community care. And it used to be called charity care. And they don't call it that anymore because that's not a very respectful title. And so community care. And if you go on any not-for-profit hospital's website, you can look up community care and you can see how much your bill will be reduced by how much you earn and how many are in your family. And you guys, it's crazy. I mean, I can't quote to you exactly what a family of 4 and what that number is, but discounts are readily available. You know what I mean? If you go look at that and you can say, oh, well, this is my gross income. And I have a family of 6 and this is what I make. And then you know what you qualify for. So Carl and OSF are accountable to the state of Illinois for giving free care or discounted care to those who fall into those categories. And it's great program. Both of them, both hospitals have great programs. And so again, hopefully healthcare makes profits. Because you want that old saying, no margin, no mission. You know what I mean? You need money to put back into the system to keep it up. I always tell people, go to a hospital. When you move to a new town, pick a hospital that's building something because they've got money to do something. You know what I mean? I mean, that's just my brain. I mean, that's nothing out of a fancy book or anything, but because they're kind of they got things going. Anyway, So that's that answer. Now your other question.
Right. So yeah, the question that has come up that I also have is, what are the income streams for a for-profit and not-for-profit?
The same. The same.
But the charges are higher on one than another.
No, not necessarily. Yeah, for-profit or not-for-profit, in my experience in healthcare, doesn't dictate what the charges are or the payments. That's all by contract. Like any healthcare system will contract out. So let's bring this now to like the nursing home model. In nursing homes, they do contracts too. So like say, for example, here in town, like I'm covered under Health Alliance, the Medicare Advantage one through Health Alliance. Okay. So they have a contract with Clark Lindsay. They have a contract with Accolades. They have a contract with Country Health. So if I need care, they pay per that contract and it's all negotiated. So the nursing homes get paid a daily rate from Medicare, Medicaid, and private pay. And not much insurance, but yes, occasionally. Yeah. Yeah. And somebody wrote, they dictate who they will take. Private pay, they sometimes do. And you guys, in a nursing home model, if nursing homes take too much public aid, it's hard. You know what I mean? Because the public aid rates in Illinois are quite low. Like, I don't know, I'm making this up, maybe $140 a day. I'm kind of making that up, but they're low. And Medicaid rates are higher in most cases, but I don't really know them all. They're by contract because a lot of people are under Medicare Advantage plans now. And then there's private pay. So our friends fortunately had the ability to pay privately once their Medicare coverage ended. And then they're paying privately. And you guys, private pay, nursing home care, pretty darn expensive. I mean, you're talking anywhere from $9,000 to probably $12,000 a month. So, and I'm just telling you my experience with the individuals that I worked with recently. And yeah, so the money comes in through a daily rate. They get paid by contract or private pay. And I saw it fly by. You're right. They have to balance it. If a nursing home takes all public aid, that would be really hard for them to make any money at all and even pay their people. I mean, it would be hard. So that balance of Medicare, Medicaid, and private pay, you got to have a mix. So whoever wrote that, is right on. And hey, and if anybody else has experience in this, feel free to pipe up. I was not a nursing home administrator. I was more I was on the hospital side, but obviously have some experience to talk about, but I'm not, necessarily a total expert in this, but this is what I understand. And so does that help, Paula? So the revenue streams are just based on who's paying and every day. Yeah. And somebody wrote, you're only eligible for 100 days of Medicare coverage. Yeah. And because we're on Medicare Advantage plans, most of it, oh yeah, we don't get 100. No, you get as much under Medicare as long as you're making progress. So I'm a therapist, so I do kind of know that. Therapists always are careful writing their notes to show, if they can, that a patient is making progress so that the insurance company, Medicaid Advantage companies, will continue to pay for your care. But once you plateau, Medicare Advantage companies, I mean, this is going to sound too harsh, but they cut you off. Yeah. And then you go to private pay, or you do that whole process with Medicaid if you continue to be, have a need, to stay. But that's when it gets hard. When Medicare doesn't pay, it gets hard. So Paula, hopefully I helped a little bit there?
Yes, you did.
Okay.
We now have other questions.
All right, I'm ready.
You can see as well. Would it cost a fortune to hire a firm to take our marketing materials and find an investor?
Actually, the company that we worked with to do the marketing model does that. We have not hired them for that yet.
But is that a possibility?
Yes, it is a possibility. Very good question. Yep, it is a possibility to market us. Yeah.
Okay. And would you remind us how many beds we need in the county?
Well, 300, but we're not going to get it. And that's okay. You know what I mean? I would be thrilled if we could get 100. I'd be thrilled. But I don't think we're going to get 100. I mean, I don't know. Again, you guys, the numbers have to work. We sure don't want to have anything that fails. So I don't want to support a bigger number just because I wish it was a bigger number. I want to support what will work financially. And I don't know what will work because we got more work to do on that. Obviously, that would be more of a part of a complete business plan, which we thought about doing, because we thought about maybe we should go ahead and develop the business plan and then just hand it to somebody. You know what I mean? So we haven't, because we don't quite know if that's the right step. We're still kind of tiptoeing around trying to figure out, how best to approach this. But I think, yeah, it's going to be important for us to know that at some point, obviously. But I can't imagine to be over 100. Can't imagine it.
Are there enough, will there be enough staff to staff these?
Oh, well, that is such a good question. I should have focused more on that when I talked to you guys. But we talked to Parkland College, and what's interesting about Parkland? They train CNAs. Okay, those are the people that we need. But the CNAs cannot be trained in Champaign, Urbana. They have to drive out of town for their site training, because none of the places here in town have enough staff to train them. Isn't that something? So we've got to solve that. And so we've got some ideas percolating about how to do that. And one barrier to admission to Parkland College's program, and one barrier admission to the adult ed in Urbana, because they train them too, they have a great program, is that a lot of these students cannot read and write adequately to follow orders and to document. Because a CNA, not a nurse, of course, but they still have to document. And in order to document, and in order to follow a plan of care, it's important, they have to read and write. And man, those are the people that I want to hire, but we need to give them a leg up with reading and writing. And so Urbana Adult Ed, Parkland, they all know that, and kind of they're working on that. How can we get more of these individuals, train them up a little bit before we get them into our training program? We got to come up with a plan, because we're going to need more help. Because you're right, staffing is going to be a problem. But you guys, I think if we can create the kind of environment, and I never would want to, I want our local nursing homes to succeed. We need them to succeed. We need accolades to succeed. Of course, we want Clark Lindsay to keep growing and going. We need everybody to be doing their part, and they're trying. They are. But it is just so darn hard, for profit or not for profit. Staffing issues, salaries have gone up pretty drastically, and yet payments, I think I heard someone say, I didn't read this myself, they have only gone up 1% for Medicare and Medicaid. But salaries have gone up more than that in the last 3 or 4 years since COVID. I mean, healthcare became kind of unpopular for a while. I don't want to work in healthcare. I think we're getting our GERT back, but it's been an issue for sure. Okay, more questions.
Yeah, there's some conversation going on in the chat, which I guess is what a chat is for. But so could you talk about the other county that has a shortage of beds, and what's their situation, and how does that compare to ours?
Well, I don't know the other county. And there's only one. And I think their shortage, I think, is like 10 or 15 beds. So for them, it's not an issue. But I did see a question in here. Somebody said, well, why are we in this problem? And the reason we're in this problem is because Champaign County Nursing Home closed. And also an owner came in several years ago and bought up the Heritage homes. Remember old Fontana and, what was that other one called? It was on Mattis. There was one on Mattis, Heritage.
Oh, yeah.
Yeah, so I can't remember. Yeah. So there were like 3 nursing homes in town. And this owner came in and bought them. I think they tried to run them for a while. I think they had a hard time and they sold them for the land. And you've seen it happen, you guys. There's a beautiful apartment complex built where that nursing home was on Mattis. There you go. So you guys, that is it. Champaign County Nursing Home enclosed, those 3 beds, boom. That's the shortage right there. So that's why what's unique about us is that we had a nursing home and it was a really big one. And again, hey, nothing on the county. It's hard to run a nursing home. And I get it. In fact, this is crazy. I was on the committee that picked the owner that they got. So I feel kind of, but honestly, there weren't many people interested. That was the only one interested. And so I think, it is what it is. There's no finger pointing here. We're just at a point and we're going to work to fix it. You know what I mean? And we've got a lot of good community support and we got the county board very supportive of us. So I think we can make some good things happen, even though we're in a pickle. So more questions. These are how do you subsidize those on Medicaid? I'll answer that. Well, this is where not-for-profit comes in, you guys, and this is where money comes in. Okay, so just like a lot of not-for-profits, they have a foundation, and so we would probably develop a foundation for this nursing home model, and the nursing home model would be supported with funds. Who knows? Maybe OSF would give money. Maybe Carl would give money. Maybe I would give money. It's a not-for-profit. Any of us could give money, you know what I mean? To help support a local entity, just like we do, many of you do, a lot, where you choose not-for-profit organizations that you believe are important and that you believe make a difference. And that's awesome. And so we'll have an opportunity to do the same thing with this new not-for-profit. So we believe that those gifts can help us with a gap, because there will be a gap. And it's undoubted that there will be a gap for us to run it the way we want to run it. You really, and the cost will be probably more the way we'd like it designed, because we want to embed tech. Oh, and in fact, we've talked to Rashid Bashir, the dean of the engineering college and with Carl Illinois College of Medicine. He's kind of pumped about it, and it's exciting to talk to him because he knows that University of Illinois can bring so much engineering and tech focus to any design, or our architect school. We've talked to one of the professors in architecture, and I think we can generate some enthusiasm of professors at the university to show their stuff, and deploy it, within our model. I mean, that'd be best case scenario, wouldn't it? Oh, go ahead, Paula.
Yeah, well, I was going to pursue a best case scenario where Greencroft, the deal works out. Okay. And you mentioned something about a certificate of need. What would have to happen if Greencroft is amenable to adding skilled nursing beds? What would have to happen for that to happen?
Well, for anybody who doesn't have a Greencroft or not, any company, not-for-profit that might have a little interest, we would have to do the business planning and, likely, bring on a consultant and do the whole business plan, do a feasibility study, get a schematic design, you know what I mean? Do the whole process of where is it going to be built? Because there is land that's that's south of Windsor of Savoy, and but again, Greencroft may not be it. So we might be having to try to procure other land. We might be knocking on people's doors and asking for some free land. I mean, I don't know, but we'll have to get all our ducks in a row in terms of understanding the true costs and what kind of support would be needed in order to break even. I mean, again, it's not like we're in it to make gobs and gobs of money. No, we'll be thrilled if we'd make, if we could, make a little money and keep the thing rolling. Obviously you need, some years might be stronger than others, and it's that mix of patience and, because years won't be the same. And, like any business, some years low, some years high. You stockpile money in a high year, you in a low year, you tighten your belt. I mean, it just kind of goes back and forth. But I think if we have some community support that's dedicated and continuous, I think it's something that we could maybe talk a not-for-profit into.
So talking about years, if everything worked out, some magic wand was waved and all the ducks lined up and everything was fine, what year would we be looking at for this entity to actually be operable?
Well, I'm a bad person to ask that to, because I'm like super optimistic.
I tend to be as well. So
yeah, so
let's get real.
Yeah, let's get real. 2027. I don't know.
Okay.
That's probably
that's basically 2 years.
Yeah, into
that seems very fast.
And into 2027. I mean, it just kind of depends on how things roll. I mean, Kathy, I know, and she's an optimist too, but she's, man, 2 years, let's get this done, and we were talking about that at the end of 23. So here we are at the end of 24. And, it's good that we have hope, hope is eternal. And so I think realistically, I'd love it if we were opening the doors and had an open house in sometime in 2027. That'd be great. And you know what? We got to work hard to get it done. But, I want to let you know, the individuals' names on that list that you saw, man, don't cross them. They're tough. They're a good group. I mean, they work hard, they're dedicated, and everybody's just doing their best to pull their weight and try to make something happen. So we're lucky to have so many individuals who are passionate about this, and that's what it takes. When you're passionate about something, that you bring a lot of energy, and and that energy is what gets the results.
Mm-hmm. So we have another question. Can you speculate why this is an issue for Champaign and not Bloomington or Peoria? Is it just the bad luck?
Yeah, it's the bad luck of those nursing homes that I mentioned, Champaign County. I mean, you guys, we counted on Champaign County for years. It's huge. It's the hugest, that's not a word. It's the biggest nursing home around, I mean, and then they built a new one. Remember? I mean, it's not new now. It's 20 years old. Ooh, and I bet some of you wonder, well, why don't we use that facility? No. I mean, in fact, IDPH told us that they'd never license it again. I mean, it's not in good shape. I mean, it would cost so much to remodel, wouldn't be worth it. And the design is not contemporary, because we want to design. In fact, I have this dream of having to design like Rush Hospital in Chicago. I don't know if any of you have driven on the interstate that goes east and west. What is that? The Roosevelt? Yeah. And it goes by Rush. And Rush is a butterfly. I love it. And I got to tour it one time when we were thinking of doing something with Carl, but it's so cool. There's a core nurses station and then wings off, like 4 butterfly. And it's just great. And that way nurses can be together, which they like to be. I mean, nurses are social. They want to be with people. And when you put them out on the ends, they don't like that. They want to collaborate, And so in that way, you can see down the hallways, because the hallways are actually also curved. And so you can see much more of the territory, keep an eye on things. So anyway, that's just my little dream design, but there may be other better ideas than that.
Okay, well, let's ask if there are other questions. We still have a little bit of time left.
And I'll also look under the messages here and see what else is on here.
Yeah, I think we've gotten through all of them.
Mm-hmm. Yeah, and Parkland's been terrific. I just can't share enough, how supportive our community is. It just makes me feel proud to live here. And also, I will say, we're also keeping the owner of Accolades, informed too. He's a good guy, you know, and he's kind of new. Obviously, he owns nursing homes, and they're for profit, but all over Illinois, mostly in Chicago and some downstate. But he's made you know, some good improvements at Accolades, and we need Accolades. So we don't want to be in the business of competing. It's not a problem. There's plenty of business, people. You know what I mean? And we're just trying to add to it.
Gotcha. Does anyone else have any questions for Lynne? Okay, well, we have a couple minutes left, but I know that there are people eager to watch the basketball game.
And
which starts at 8 o'clock.
ILL.
I.
All right.
Okay, well, Lynne, thank you so much. This was very informative. I can't say it was uplifting, but I mean, you did give us some hope that
Yes,
something will
yes.
happen.
I want you to consider it uplifting, or I'll be sad.
Yeah, well, I mean, the situation is not
the
uplifting.
situation,
Your
right.
work certainly is. I mean,
Yeah.
it's very comforting to know that there's a group that's really working so vigorously at this.
Well, you guys are a great group. You had so many interesting comments, and you know, yeah, it's fun to talk to you. And I hope that you'll send me an email if you'd be interested in being on our advocate list. I'd really appreciate it. So Paula, thank you for hosting me, and thank you all for being here tonight. Appreciate it.
Okay, well, thank you.
Good night.
Good night.